So here's what my breathing assessment looks like. I've derived a lot of this from PRI, which is Postural Restoration Institute. They're genius. They've got a lot of really cool ways to get the rib cage and the pelvis to communicate a little bit better, especially with a cyclist. Breathing is super, super important. So the way that these two interact is actually going to change the way you breathe, and vice versa. It's kind of a chicken before the egg type discussion, but the two affect each other. So some of the tests that I use will place the person in a certain pattern group. I'll look at a postural analysis. Do I see the right shoulder sagging down? Do I see the right shoulder back? Do I see them on their right heel? These are all things that tell me that they're a left AIC, right BC pattern person. Do they have ribs up, anterior tilt? How do they carry themselves? How do they stand? Do they stand disconnected in the front? That'll tell me that they're a PEC pattern. And all of these patterns that people fall into require different intervention. The beauty of it is it's really only 2 or 3 exercises. So I can give them to, like for example, the cyclist that I'm training in this example, I can give them just 1 or 2 exercises that take 5 to 10 minutes, maybe every other day, and you can see some dramatic results with how these two communicate, and then things get better down the line. Like I'll see a lot of right shoulder internal rotation improvement, you'll see left hip internal rotation improvement, right hip external rotation improvement due to the way we breathe. So the way that I actually assess this is again with a postural analysis, but I'll actually put the person on the ground. I'll go this way. So I'll have them lay down, and unfortunately I don't have anybody to demonstrate on, but I'll have them lay down like this, and then what I do is I have them breathe in, and I actually put my hand wherever they'll allow me. I realize this is a female, so I would have to obtain consent, but even if that's not the case and I can't put my hands on them, they're not comfortable with that, you can't see my head, if they're not comfortable with me putting my hands, I can just look. It's a little bit less effective, but I can still see what I need to see. And I ask them to breathe in, and do I see air coming into the right upper quadrant? Do I see air coming into the left upper quadrant? Right lower, left lower. If they fall into a left AIC, right BC, they're not going to bring air into the right upper and the left lower. That's a problem. And again, just a couple drills, breathing drills that we can get to actually get the left ribs to internally rotate. I can certainly answer more questions on this. This is a rabbit hole that is extremely deep, and I don't want to type out 3 pages of this on the paper and bore you. So the breathing assessment is really just to see how do they breathe. Do their ribs internally and externally rotate as they inhale and exhale? And if the answer is no, then we need to establish that. You need ribs that internally and externally rotate as you inhale and exhale. And you also need them to do it equally on both sides, or else you're going to start to see these pattern manifestations with the left AIC, right BC, and PEC pattern.